Texas has reported the first case of the Zika virus to be contracted inside the United States. All others had come from people who'd been traveling abroad. Local health officials say that the disease was not transmitted by mosquito, as in prior cases, but by sexual contact. Earlier, the World Health Organization warned that the Zika virus, which has been linked to brain damage in newborn children, could spread to Africa and to Asia. An outbreak in Latin America has led the WHO on Monday to declare an international public health emergency. For more, I'm joined now by Dr. Anne Schuchat. She's the Principal Deputy Director of the Centers for Disease Control. Dr. Schuchat, first of all, can we clear up what we know about how this case in Texas was contracted? Because we've been speaking here at the BBC to people at your organization at the CDC, and they're suggesting that it's too early to say this was sexually transmitted, and yet the Department of State Health Services in Texas has suggested that.
CDC's lab has confirmed the first case of Zika virus in a non-traveler. We don't believe this was spread through mosquito bites, but we do believe it was spread through a sexual contact.
So you are saying that it was definitely a sexual contact?
The evidence that we have right now points to that. There's no evidence of a mosquito problem in the area. And the critical thing here was there was no pregnancy involved. We don't think there's risk to a fetus. And for the Zika virus, right now, it appears that it causes no symptoms or mild symptoms in most people who contract Zika virus disease. But in pregnant women, it can potentially cause severe birth defects. And so, fortunately, there isn't that type of harm in the circumstance that we're seeing.
Okay. Dr. Schuchat, I mean, if we are now seeing a case where Zika has been contracted by a method that we did not know of before, what does that tell you about how you have to combat this disease? Presumably, this changes the equation.
Well, there was a report in the literature before about possible sexual transmission, and so in some sense this wasn't surprising. But, you know, early days in a new syndrome like this, we have to keep an open mind. CDC is working 24/7 to get the answers that people need, and we are taking appropriate steps. We will be updating guidance soon about the implications of this event, but we think the key message for people is that most people who get this virus have mild illness, whereas if you're pregnant, we're really urging you to consider postponing travel to affected areas.
Does this mean that Zika could be spread more quickly than we had previously thought here in the United States, for example?
Well, based on everything we know right now, the vast majority of Zika virus is being spread through mosquito bites. This is a difficult mosquito to deal with. It's a daytime biter, an aggressive biter, but we think that the mosquito is the principal target of our attention right now. But I have to say, we learn as we go, and we share what we know as we know it.
Infectious disease experts here very sensibly have been telling people not to panic because actually, particularly here in the United States, because there are fewer sitting ponds with mosquitoes in them, people have air conditioning, that kind of thing. It's not like Latin America. But there are areas of the U.S. territories, Puerto Rico, for example, the U.S. Virgin Islands, where perhaps that prevalence is more likely.
That's right. The continental U.S. has circumstances that haven't really been ripe for spread of similar mosquito-borne viruses, even though we have had dengue and chikungunya importations and a little bit of local transmission in the continental United States. We haven't seen the big outbreaks that have occurred in Latin America. But as you mentioned, in Puerto Rico, in the U.S. Virgin Islands, many Americans are living in circumstances where the mosquito situation is quite different.
Okay, Dr. Anne Schuchat, thank you very much.
You're welcome.